Well, welcome back, everyone. You know, we are improving our emergency response system here, and here to talk about that is Dan Faraglia and Rick Skilliter for the Mental Health and Recovery Services Board of Allen, Auglaize, and Hardin counties. Welcome, gentlemen.
Thank you.
All right, so you guys got a new grant. Tell us about this grant and what it does to improve our emergency response.
Yeah, so it came from the Bipartisan Safer Communities Act, and the funding is dedicated towards emergency preparedness. And we saw this opportunity, and from the board's perspective, reached out to Rick and his team at PASS, who does a lot of the prevention and training and crisis response work. So we got the brainstorming and found where we could bring some just incredible items to the community. You know, anytime we can get funding into the community that'll help not only the folks of the community, but the people that are providing that service, we were very excited.
Right. So when you say bringing it into the community, does this go to like a specific members of the community, or like what is that?
So really, the critical incident stress management team has been around for about 25 years. It's ebbed and flowed. It's emergency services, supporting police, fire, and EMS, but also schools when they've had a tragedy. With this funding, they expanded it to be able to respond to man-made acts of whatever and natural disasters.
Yeah.
And so we're being more comprehensive. So when you say who can it serve, literally anybody in times of crisis or disaster.
Yeah.
We're, as you can see by the equipment, you know, we got a lot of wonderful stuff thanks to the Mental Health Board and the grants to be able to help people connect. So if the power goes out, I didn't bring it today, but we actually were able to get a portable generator that comes with the package. There's technology for computers to log into or connect with. We have a hotspot if the internet's down, but yet we can communicate through the towers, able to do that. And then just some safety stuff for our own people when they're out in the environment. It is not about going out and putting the fire out or that kind of stuff. Police, fire, and EMS will continue to do those things, but it's about providing support and emotional stabilization in the aftermath of those tragedies.
Right, so those like the fire, the EMS, they're still in play, but just it's in addition to.
Yep,
right?
It's when that is kind of stabilized or settled, there's that human piece. And when we talk about helping people respond, be resilient, the earlier they have that information, they know what the resources are, the more effective that resiliency is. And so we're really trying to help not be a delay in people seeking help, but literally putting help on the ground with them shortly after the other has taken place.
Yeah. Now, have you found yourself being called more often? I guess just two different scenarios that are you coming along with, or?
Yeah. So the traditional police, fire, EMS tragedy still happens, and we get called to those. But we are seeing more and more, sadly, of the schools that are impacted, some community organizations that are impacted. That cause us to need to be out there. I should plug that last year, 2023, the team collectively put back into the community about $93,000 worth of investment, either in training and response. This year, we're already over $103,000 in give back to the community. So this is great stuff, but it's actually coming back multiplied in the form of services back to the community.
Yeah, definitely. And I noticed the big, yellow vest. You're not going to be missed if you wear that.
Yeah,
so.
It's not about being at the directing traffic and that kind of stuff vest. It's about being recognizable so people can know, hey, go to one of those people if you need that type of support. And of course, the Red Cross is a valued player in those events as well. We're going to walk alongside and be able to support whole responses.
Yeah, so that's amazing. So anything else you want to add before we?
No, I would just say I'm always in awe about how many members that are on this team, because we're not only serving the folks that are immediately affected by the crisis, but also the first responders that then are dealing with this situation, or were unprepared because it's a tragedy. I think Rick has well over 100 individuals just in our small community that can respond when need be. So it's very impressive. Good work being done. We're excited to be a part of it.
Yeah, and that is very true about the first responders as well. They need the support as well. So, gentlemen, thank you for coming on today. I appreciate it. There's congratulations on the equipment and also keeping everything with the community together. So.
I will say we're always looking for new people, so they can reach out to the Mental Health Board, reach out to us at PASS. we'd welcome them in.
Yeah, and I also want to remind everyone to text START to 888-701-2578 to receive any community text alerts. So that's also important. So, all right, well, Rick, Dan, appreciate you coming in.
Thank you
so much.
All right, well, don't go away because we have more when we return.